Hello viewers and welcome to Medgate Today TV Digital. We are at 7th edition of Thought Leadership Summit, an initiative by HOSMAC. We have Mr. Prateem Tamboli sir, who has just delivered a very brainstorming and wonderful session on cracking the hinterland code, making healthcare work in smaller cities. So let's ask sir how he sees the scope in smaller cities to become the best for the healthcare initiatives and make our India proud in this. Hello sir, and thank you so much for coming here. Could you please introduce yourself to our audience?
So, hello viewers, I'm Prateem Tamboli, Chief Executive Officer for JECRC, Medical College Hospital and Research Center. This is an upcoming 1445-bedded teaching hospital with an MBBS intake of 150 seats. While to answer this question, wherever there would be a human being would require for sure a healthcare delivery system, whether it is smaller city or large city. To answer this question, in smaller cities which have a population which is close to 10,000 to up to 5 lakhs, we generally call them as cities, and cities which are having population more than 50 lakhs or so would qualify into metro cities, so on and so forth. However, when I see in Rajasthan, or when I see even in our country, we have thousands of cities like this, we call it towns, over 7,793 such places where we require a tertiary care health delivery system because we are 142 crore population. We require, if I see the doctors, the beds, if I see the 1:1,000 for doctors as a population, we require 3 nurses for every 1,000 population. So that means we still have a huge gap to impart the tertiary healthcare quality delivery system to our towns which are more than capital cities or metros. And in order to bring that, it's a responsibility of not only government but also private healthcare players to make sure whether it's a teaching hospital, whether it's PHC, CHC, sub-centers, right as the protagonist of the healthcare delivery up to ASHA worker, to ensure that we are able to cater to the needs which are, for example, taking care of non-communicable diseases, making a behavior of preventive health rather than just focusing on treatment and so on and so forth, and developing an ecosystem where we are able to generate the delivery of healthcare right at doorstep. And that's what I see a huge opportunity across our country, across our Rajasthan, where more than the metro cities, I see that tier 2, tier 3, smaller cities, which are having a population of 20,000, 30,000 population as well, would require secondary and tertiary care health delivery system, which would be focused with center of excellence in larger towns.
So how do you see the government of India taking the initiatives to boost the care in tier 2 and tier 3 cities?
So, phenomenal. Reason being, if you see the extent of development which has taken place in government of India by policies like whether we talk about Ayushman Bharat or we talk about policies which are being done for academics in the field of medicine. We have by far in Rajasthan almost every district we want to have a medical college, and which will ensure that healthcare delivery reaches to the last man sitting in the row. At the same time, inculcates opportunity for employment, make sure people do not have to move to larger cities, they don't have to move for care, for basic needs as well as for tertiary care. Also, it would improve the healthcare index of our people and a behavior where, as I say, that it would not be possible that we keep on increasing number of hospitals and people would be healthy. So it's not that more number of hospitals would bring a better health care amongst our people. It's a behavior change which is going to take place with large number of hospitals coming up, which are tertiary care at the doorstep. At the same time, improvement in primary, secondary, which will be taken care because of the mohalla clinics or city clinics, what we have seen by government.
Yeah. Thank you so much, sir, for giving us such kind of solutions and the key initiatives taken by the government. And we hope that the people who are listening to such kind of interviews will get a lot of insights and bring the change into the healthcare society. Thank you so much.
Thank you.